Hello, and welcome to today's webinar, where we will explore how the healthcare sector can contribute to digital equity and close gaps for people who are marginalized in the United States. We'll discuss takeaways from a new research report, a call for collaboration between the health sector and digital equity organizations. This has been commissioned by Digitunity and spearheaded by Amy Schoen of Public Health Innovators, LLC. Hi, my name is Carissa Tashton, and I'm the Director of Programs at Digitunity, and it's a pleasure to be with you today. I'm joined by Program Officer for Technical Engagement, Nirvan West, and I'd also like to acknowledge my colleagues Sue Krautbauer and Brian Barrett, who have helped behind the scenes to make this webinar possible. Digitunity is a national nonprofit focused for close to 40 years on advancing digital equity, with a particular focus on device ownership. And engaging healthcare is important to expanding device ownership, which can be expanded through the health system's involvement. Collectively, we continue to design solutions, break down silos, and better serve community members and patients. If you have questions along the way, please drop them in the Q&A panel, and we'll answer them during the Q&A segment of the webinar. We also encourage you to use the chat to share resources and connections. We'll be sharing a recording of this webinar via email, as well as a copy of Amy's new report. I welcome you all, and I hope you find this session helpful in your work. So to get started, we'd love to know who is on the call. So please complete this quick poll identifying your primary sector. Thank you for indicating your sector, and we'll be able to take a quick peek if Nirvan will pull up the results for us and see who's here. A very strong mix of folks. So we're so glad to see folks from all different parts of actually the digital equity the continuum that needs to be part of the solution. So we're so glad to have you with us here today. So now I'd like to invite our panelists to introduce themselves and describe their connection to digital inclusion in general and health in particular. First, I'd like to invite Sion Tesfaye to introduce herself.
Thank you. It's so great to be here. I'm Sion Tesfaye. I'm a Senior Research and Policy Manager at the National Digital Inclusion Alliance. We're a nonprofit that really just focuses on supporting community programs, so supporting the work on the ground and equipping policymakers to act. So support advocacy efforts too. We have now 1,500 affiliates in every state and in 53 tribal entities. And our community has really grown over the past few years. But we also make sure to recognize that, there have been people doing this work, helping people get access to affordable broadband, helping people improve their digital skills for a long time before we had some of the more recent vocabulary that we use today. We really pushed, and I'll have a minute to talk about this a little bit later, but we really advocated for digital equity to be included in the Infrastructure Investment and Jobs Act, which passed in the fall of 2021. One of our big goals as an organization is to connect people doing this work. So we connect state broadband leaders working on digital equity plans for their state. We convene digital equity coalitions in multiple states. We create a forum really for people to connect from all over the country. We convene digital navigators, people working to help people enroll in the Affordable Connectivity Program. So we also conduct a lot of research and support for digital inclusion with policymakers. So we make a lot of guides and toolkits to help organizations. So it's great to be here with you all.
Thank you so much. Digitunity is a longtime affiliate of your association. We thank you for all you do. Next, we have Dr. Catherine Kim with us today.
Thank you so much, Carissa. I'm so pleased to be here. I'm a principal with the MITRE Corporation. We're a nonprofit research and development center. We operate federally funded research development centers, one of which is the Health FFRDC on behalf of CMS, and including support for all the federal health agencies such as National Institutes of Health, CDC, and others. So I'm a researcher focusing on consumer health informatics. I look at how technology can be used to support collaboration of patients, family members, and community members with the healthcare system. So the kinds of research that I do really focus on providing these digital tools to patients and communities, but making sure that they have the resources needed to use them efficiently and effectively. And that includes addressing all of the kinds of digital equity barriers that NDIA and Digitunity are working every day to solve. So we put those into practice in interventions in the community. So I'm really pleased to be able to share my experience and whatever resources I can to this webinar. Thank you.
Thank you. Next, we have Teresa Slawdek with North Star Digital Literacy.
Hello, everyone. I'm Teresa Slawdek. I am with North Star, which is a part of Literacy Minnesota. Literacy Minnesota is a nonprofit that's been around for 50 years, and our focus has always been in the adult education sphere. So helping people who want to learn English or want to learn to get their high school equivalency with reading, writing, and math. And as part of that journey, we have developed North Star Digital Literacy, which is a platform, a web-based platform that is used to help assess and educate people on basic digital literacy skills. So starting from how to turn on a computer, how to use the internet, how to use email, up through some mid-level skills. And because we work with adults on literacy, it is written at a lower reading level to make it more accessible to people, and at a low digital literacy level, and it is used across the country and in, I think, 10 other countries. We have 3,000 subscribing organizations that use North Star and make it free to individuals. And we do have a free version too, as well. The types of organizations that use North Star are libraries, workforce centers, adult education, colleges, businesses, and more we're seeing healthcare using it. And so our intersection here is that for the past probably 2.5 years, I've been talking to a variety of different people in healthcare institutions to find out what are some of the issues that they are seeing patients have. And then on the flip side, talking to our subscribing organizations who are working with individuals to see what kind of problems they feel they are having in accessing healthcare, especially through telehealth or through healthcare portals. And so North Star, we have felt that this is something that we wanted to increase people's knowledge around, and have started looking at what are some of the skills that are necessary to access these types of healthcare. So that is my perspective. I'm really excited that Digitunity has put this webinar together, because I also, as you can see from my title, I work on strategic partnerships, and that's primarily with North Star, but also with the Digital Equity Act. I've just been in so many conversations just about digital equity and the strength that partnerships between all these sectors can bring to our communities. And so I think this is very timely and needed conversation. So thank you.
Thank you so much. Yep, today's all about the intersections of items and issues. So I'll leave it to Amy Schoen to take us home in introducing herself, and she'll be our hostess through the rest of the bulk of the webinar. Thanks, Amy.
Thank you so much. And let me first acknowledge our attendees, who you guys know how to do this. Please, we welcome you to put your names and contact information in the chat, and to make any comments, but your questions for the panelists, don't put them in the chat, put them in the Q&A. So I first want to really thank Digitunity for giving me the opportunity to put on paper the thoughts I've had over the last 10 years about how healthcare can connect with the digital inclusion world and vice versa. And then for putting this panel together and issuing the report in a beautiful way. And also the panelists, you are my dream team. We've got, really terrific exemplars of NDIA, which is just in a class by itself. Let's just put it that way, as far as advocating for the digital inclusion community. And Kathy, whose organization is doing exactly the kind of work that I've envisioned and wanted to, be going on for many years. And Teresa from North Star, because they have a solution that I think is really optimal for healthcare. So just to let you know who I am and how I got here, I've had about a 30-year career in public health, working on things that everyone now knows as health disparities, vulnerable populations, and social determinants of health, although they weren't called that back then. But I've also had this affinity for technology, which is kind of unusual for someone coming from the more public health background. And I was especially intrigued by the potential for patient portals and for wearable devices to benefit vulnerable populations. But right alongside that, of course, was the fear that they would exacerbate health disparities. I was very fortunate to have been hooked up with Cleveland, Ohio, where I live and work, and national leaders in digital inclusion at the very beginning, near when the National Digital Inclusion Alliance was established. And just before the pandemic, NDIA appointed me as a senior fellow, and I started creating a model for digital inclusion in healthcare. A few months into the pandemic, I started getting calls from healthcare systems saying things like, "We know you've tried for years to get our attention on how to connect electronically with vulnerable patients. You have our attention." And so I also got asked to help the Telehealth Equity Coalition get started. And so with all that, I took a leap of faith and quit my job at Case Western Reserve School of Medicine to do full-time consulting. And now it's just really the honor that I have to help groups like Digitunity achieve their wonderful ambitions. So, and thanks to NDIA, for the first time in my life, a cause that I'm passionate about has money behind it. So, the opportunity to make an impact is just really profound. And the reason we're here is because I think the health sector has an especially profound opportunity to make that impact, but has been pretty much left out or left itself out of the conversation. So I'm going to go ahead, if you want to put up my first slide, and jump into exploring why health needs digital inclusion and why digital inclusion needs health. Go ahead to the next slide. So ending racism in healthcare and ensuring equitable quality of care and access are no longer just buzzwords in healthcare, but increasingly healthcare's accreditation and funding depends on it. And also the payment reform around healthcare is incentivizing healthcare to make people well rather than just delivering more care. So healthcare is concerned with helping people address the non-health related factors that affect their health, such as income, education, and housing quality. So with the internet now key to both healthcare delivery through telehealth and portals and to meeting social needs, health systems are recognizing that patients' digital barriers must be addressed. And of course, people who are older, poorer, and have language challenges are the ones who stand to benefit the most from health technology, but are the least likely to use it because they are also the groups that have the biggest hurdles to digital inclusion. However, by and large, healthcare doesn't really know that the digital inclusion ecosystem really exists. And often when I start working with health systems, they want to kind of invent everything themselves. I'm like, no, you're not, I don't want to see the doctor taking your phone and saying, here, let me download my chart to you, which is to this day what many think is a good solution. Rather, I want that left to the experts. So go to the next, so let me just pay tributes, by the way, back to that last slide for a moment. That's graduates of our Ashbury Senior Computer Community Center, who I know is with us today, one of the early and wonderful exemplars of organizations, a community organization, teaching people to use digital technology, but also with a special interest in health. Okay, next slide. So why is it that digital inclusion needs health? Well, health have data superpowers. They can, I won't say literally push a button because they actually have to push quite a few buttons, but they can identify millions of people who are not connecting electronically with healthcare. Many of them are because they don't have the internet, or they don't use it, or they don't feel secure using it for something as sensitive as their health. And healthcare also has methods for engaging groups of people who have particular barriers to care, which tend to be exactly the same groups that have technology barriers. Doctors are very influential, and they can be very effective at encouraging patients to use technology. But healthcare's super duper power comes because they have every patient's address plus all this other information about them. Now, what this complicated graphic is showing you is, this is one particular community, and it's showing you which neighborhoods were designated as redlined, that the government would legally discriminate against them and say, we should not lend money there because Black people live there, because Jews live there, because immigrants, undesirable immigrants live there, versus green. And then you can see that that communities that were red on the left stayed red today, meaning they have, even though that kind of discrimination has been illegal since 1965, they have been continued to be resource deprived due to structural and institutional factors like racism. Whereas a community that was, rated good for lending, probably because they had covenants that, kept out those undesirables, those have remained the strong neighborhoods today. So people who are poor or Black and brown have increasingly been segregated into these neighborhoods where it's very difficult to be healthy. And coincidentally or not coincidentally, those are the same neighborhoods where the internet is either expensive, slow, or not available. So the interests of healthcare and digital inclusion are really, really, really aligned. By partnering with digital inclusion organizations, healthcare can really work at scale and intervene with people who have digital barriers, and they can show the impact of those activities, not just for all their patients, but broken down for those different population groups and different neighborhoods. So that is a superpower that if anybody can tell me another organization that rivals that, I will stop saying healthcare is unrivaled in its ability to do that. Health officials can also be really influential advocates for digital inclusion policies, such as explaining to Congress the importance of continuing to make affordable internet available, because it helps people with healthcare. It makes healthcare more efficient, more effective, saves money. So, I'll end making my case and turn it over to the panelists. First up is going to be Kathy. And I want to ask you, what are the most important things that people who are not working in healthcare should know about digital health? Is it just telehealth? Tell us all.
Yeah, thank you so much, Amy. And I wanted to start with just this one slide because digital health is a really complex sort of ecosystem. And a lot of times people think it is telehealth, meaning virtual visits with your physician or a specialty consult where a patient is attending with their doctor, and on the other end is some specialist that's doing some sort of consult. But it's really much broader than that. And so this graphic shows the purposes of digital health along the top. So those are things ranging from, setting goals for both personal health as well as clinical health, and shared decision making among patients and providers. But it's also health information and health education, remote patient monitoring for chronic conditions. It does include telehealth or telemedicine, real-time monitoring for hospital at home, or even the very complex procedures such as robotic surgery and other acute clinical services. So it's a really broad range of purposes that are involved in digital health. And then but the point is, health is about being in touch with people. So it's the right level of touch that you have to have. We have to put our hands on people to provide health care. Along the bottom are some of the technologies. I think ones that people are most familiar are the ones that we might use in our everyday lives. It might be our smartphone. It might be a fitness tracker like a watch that you wear. It might also be monitoring devices for conditions like diabetes and hypertension, so your glucometers, your blood pressure cuffs, and other things. But it also might be technologies that you engage with while you're in the hospital. So those are the things that we're familiar with, but there are lots of other technologies that maybe are more behind the scenes. Things that are also emerging, like augmented reality, that can be tools for immersing people in sort of a 3D environment, so that you could learn how to use different kinds of technologies that an individual might need to use. But behind the scenes, it's also the data that comes from all these devices, from all these sources, that we need to be able to share across all the settings where we are, where we live our lives and where we engage in healthcare. Might be the ways that we analyze that data, such as machine learning and other kinds of computation methods. It also includes what we learn from all of that information and all that analysis. So those are what I would call the insights, what we've learned from it and how we can apply that. And that gets into artificial intelligence. What can the machines learn and do beyond what we've specifically programmed them to do? And then finally, it's governing the policies around digital health, and it's governing the programs that use that technology. So if we think about that broad ecosystem, then that means we all have a place, we all have a role to play in that, whether we're the individuals that are patients or individuals in the community, or we're the people developing the programs, or we're the government regulators, or we're the service providers. We all have a role to that. And especially in that center there, thinking about all those barriers that are compounded when you think about digital health. It's barriers to digital equity. It's barriers to accessibility, the ability for people of all levels and all physical conditions to use these technologies. It's barriers to care, and it's barriers to self-efficacy, ability for each of us as individuals to do our best at maintaining our health. So this ecosystem graphic is really to show that digital health is a very broad field, but that every one of us has some role that we can play to address digital health.
Kathy, thank you so much. I'm seeing lots of kudos for the graphics. And you will get access to the recording, I know, afterwards, so you'll at least have some access to it. So a question for Sian and Teresa. It's taken 10 years for to break the assumption that many people in healthcare have, that they look out in the waiting room and they see all their patients on smartphones. And so they assume, and I've been saying this for like 12, 14 years now, that um, that all patients have smartphones, everybody can do whatever they need with no instruction or customization. What do people in healthcare need to know about digital inclusion? Why don't we start with Sian?
Thank you. And thank you, Dr. Kim, for your great synopsis here. On the issue of assumptions, I'll give you an example of a patient who encountered a barrier in trying to get care recently. He participates in the Affordable Connectivity Program, and he told us a story of walking into a clinic, and the first thing that greeted him, wasn't a human. It was that the iPad, the tablet rather, and he was so overwhelmed with doing the sign-in process with that, he didn't even want to ask anybody for help. He just walked out, right? And so, it not only do some people have challenges interacting with technology, sometimes they don't even feel comfortable enough to ask for help. So avoiding those assumptions that people can readily engage with technology in the way that you want them to is, part of the first step, and developing some sensitivity and seeking out the needs and the barriers that people face. But what I'll say to people maybe learning about this space, digital inclusion, for the first time, is first that this is not a closed door, members only group of people. The digital equity community is made up of people from a lot of different academic disciplines and a lot of professional backgrounds who are noticing some common challenges, especially with people who have faced just enormous barriers to daily life. So older adults, people who have been, victims of racism, people living in poverty, recognizing that some of the barriers that they're facing with trying to go about daily activities because they don't have access to affordable broadband, or they don't know where to get digital skills training. So I just wanted to start out with that. If you're here and really interested in this, welcome to the movement. I know that, a lot of times when we're talking about digital health applications, we're focused on the skills, and that's really important. But it's also important to keep in mind that there's a lot of people who can't afford access to home broadband. There's a lot of people who still have, language barriers and literacy challenges as well. So I think those are the big foundational things to understand about what this movement is and what we're trying to achieve.
Thank you so much. And Teresa, your organization has a solution, a technology-aided solution to teach people technology. Healthcare has people who are experts on health education and health promotion. They're trained to teach somebody how to use an inhaler, a spacer bar with their inhaler. How is teaching digital skills different than what health people know how to teach people to do?
Well, for one thing, this is a great question. And I want to preface this by saying that a lot of our subscribing organizations are healthcare who are looking for digital instruction for their employees. So one, assuming that everyone in healthcare has all the digital skills is an assumption. But two, people who, and we kind of touched on this, but people who have lower or no digital literacy skills are often very afraid of digital devices, of using them, they're afraid they're going to break them. They're afraid they're going to mess it up. They're afraid of their own ability to actually learn how to do it. And so if someone is working with them who maybe is making assumptions about what they already know or who's using jargon, that is just going to increase that fear, and probably, like someone said in the chat, they'll just walk out the door. So I think that that's one thing for healthcare to know, is that to meet people where they're at this very low digital literacy, and it takes patience and time, and that may not be what's available to in the healthcare environment. I also think that, we touched about there are language barriers. So just in terms of literacy itself, there may be words that are not being understood even outside the digital literacy training. And so knowing that, people tend to really want to practice the skills and repeat the skills rather than just being told how to do it. You most likely aren't going to remember how to do something digitally if you're told once. And we see, especially, not especially, but the case I'm thinking of with older adults, they really want to go through it multiple times to feel comfortable and competent in the skills.
Okay, thank you. So let's drill down now and get more specific on, say, telehealth skills. So during the pandemic, the rules around telehealth were dramatically relaxed so that providers could use WhatsApp or FaceTime or texting or whatever the patient wanted, and they didn't have to stick with the very, very strict HIPAA data privacy and security rules. With the end of the public health emergency, that's gone. So I'd like to talk about what are the specific skills that are needed with telehealth that somebody who might know how to do a video FaceTime visit isn't going to necessarily know. Why don't we start with Kathy here, who can be very concrete on this, and then we'll kind of go out a little bit from there.
Thank you. I think in digital health, you have to have all of the basic, technical skills about how to use a smartphone, how to use a computer, how to create an account, a password, all of those kinds of things. So there is a baseline of technical skills that you need. But on top of that, think about the complexity of health tasks, right? So if you are a smartphone user, but you've never tried to do digital health on your smartphone, what you might run into is even, for example, somebody with low visual acuity, older people who need reading glasses, or two different kinds of glasses for seeing close and seeing far. For someone with hearing challenges, if you're on a smartphone trying to just access your patient portal, to see your medical records, to check your medication refill, to look at your lab results, it may not be enough just to be a smartphone user, because that information is so dense, it's small, it's language that you might not understand, it's complex medical terminology and numbers that say this is your lab result and then here's a range. Imagine trying to do that sort of difficult cognitive task to understand the healthcare information while you're trying to even just see it, right? Just trying to access it on a smartphone. So a lot of complex healthcare tasks cannot be done very efficiently on a smartphone. Another kind of example would be just understanding what the data means and who do I get help from to understand what my health information means. So it's not just being able to access it, but could I ask a nurse what this means? Or do I need to talk to a physician or another provider if there's something that seems like not in range? Like, how do I actually get that help to understand the healthcare content, not just access it? So those are some of the complex things that happen in digital health. They go beyond what you might do for general digital literacy.
Thank you, Kathy. And Sion, we've heard a little bit about skills and a little bit about devices. Talk to us about the whole package. What is it that every patient is going to need and what don't they have right now?
Mm-hmm. Well, I first want to affirm a few things Dr. Kim spoke about. which is the need for an appropriate device, a device that is actually going to meet their needs. There are some things you can do, on a smartphone, but not everybody feels comfortable trying to use that phone to engage face-to-face with their healthcare provider. So that's one of the roles of a digital navigator, for example, is to help people articulate what their needs are and get them access to an affordable option. And I also wanted to affirm this issue of the double burden. People who, some people who enter into healthcare settings are already facing a lot of economic hardship, differences in education levels, and then differences in how they understand and interpret healthcare terminology. And then to add to that, the barrier of navigating an application that's not intuitive to them is really overwhelming. So I wanted to emphasize and affirm that. I also would be remiss if I didn't talk a little bit more about the Affordable Connectivity Program and its role in supporting people accessing healthcare from their home. So many of you may be familiar with it, but this is a program that was established in the Infrastructure Investment and Jobs Act, $14 billion. It gives people who are participating in certain government assistance programs or are at below 200% of the federal poverty level, a $30 a month benefit to go towards their broadband bills. Over 21 million people in the country right now are enrolled in this program, right? So it's helping people get connected who weren't connected before, but crucially also it's helping people stay connected. So avoiding those interruptions and services as well. And we're in a really big advocacy push right now to make sure that there's more funding in the congressional 2024 budget for the Affordable Connectivity Program, so that people can, continue, so people can maintain their connection, don't have to make really hard choices about what other important expenses they have to cut from to afford their broadband bill and maintain that connection. So I want to emphasize the role of affordable broadband to support all of these efforts in healthcare.
Sian, thank you. If anyone on this call from the health sector were to want to advocate for keeping the Affordable Connectivity Program funded, is there someone at NDIA that they could let know? Have you ever used people from healthcare to advocate?
That would be a welcome voice to this process. I would wholeheartedly welcome support from physicians or other public health entities to, voice your support for the Affordable Connectivity Program, and to talk about really what it just means to their patients, what it means to the community. So we have a site dedicated solely for this effort now on our website, a page rather, and we've got toolkits and talking points and things that you can use if you only have 5 minutes to make a phone call. We encourage people to get on the phones and call their representatives and really talk about what happens when patients are able to maintain a connection, perhaps what kind of patients might really rely on telehealth services. Policymakers really need to get the full picture of what people are using the internet for. Yes, having access can, help you connect to very enriching community activities, social media, things that we all use the internet for. But some people have a very limited perception of what people are using this benefit for. So I think physicians' voice, clinicians, anybody in the health sector that can help paint a picture of the need would be really crucial. So me, anyway, to answer that question, you can reach out to me and I can connect you with the resources that you need to share your perspective.
Thank you. So I'm going to turn to Teresa and let's kind of zoom in on solutions. I know that teaching skills to patients to use telehealth, it's kind of like been an arms race just as we get geared up to teach them, okay, here's how you click on the link and here's how you adjust your speaker and your microphone. I don't know about your patient portals and telehealth, but mine, now I have to fill out a survey and I have to confirm my medications, and they even want me to pay online before the telehealth visit. So, Teresa, talk a little bit about the solution, like how the North Star solutions might be able to be applied to the health sector, starting with the telehealth readiness assessment. Many health systems are addressing patients, they're screening patients routinely to find out about their various social needs. And a few of them are starting to screen around digital readiness needs. So what do you all have for that?
Well, thank you, Amy. So with North Star, as I mentioned, it's a web-based platform, and we have 15 different topics, one of which is accessing telehealth appointments. And the way we look at teaching and learning and assessing is that for these topics like accessing telehealth appointments, we first start by looking at creating standards, and those are basically the skills that we feel are needed to be competent in this area. And they're very concrete skills. They're very measurable skills to see if someone can perform something like accessing telehealth appointments. We then create an assessment that, again, it's written at a 4th grade reading level, that allows, the assessment is typically scenario based, except for some of the really basic computer assessments, and with real world scenarios that adults would encounter. And it is, rather than theoretical or kind of report, sometimes you'll see assessments like, how often do you use your cell phone to access information, something like that. It actually requires you to perform the skill in the assessment. So you can see whether or not you actually know how to do the skill. Once you're done with the assessment, or the patient is done with the assessment, there's a results page that will tell them which of the standards they already know and where there's an opportunity to learn more. So it really hones in on each individual's learning needs. So you're not wasting time going over information they already know, but really focusing on those areas that they might have yet to learn. And then tied to the assessment are different types of educational materials that help someone learn those standards. So some are more self-directed, that they can, if they have the kind of basic skills, they can do that on their own. And then there are some that are more instructor-led. So if you're thinking of a digital, someone mentioned digital health navigator, that would be a perfect use for that or a class. And then people take the assessment again to see, their score improve, which I will say is very motivating for people to see their score improve. As I mentioned, people can be very anxious about learning this material, fearful, and to see that they have the agency, if they put the time and energy into learning the material to improve their score. I've had people start crying when this happens in joy. They give me high fives. North Star gives certificates if you pass the assessment, and they'll hang them on their walls. I've had people write to me saying this has changed my life. So it's very empowering, and not just in digital health literacy, but in people's perception of their ability to learn new information. And so that's just why we do this.
I'm so glad we're kind of wrapping on that positive note, because we're running toward close to time. We're going to turn to questions. What I had wanted to ask was, okay, the Medicare Advantage program is going to be required to screen millions of patients for digital literacy. Is the digital inclusion ecosystem ready to help healthcare on a large scale to deal with this, but that'll have to be for another time. So I'm going to turn it to Carissa to moderate questions.
Yeah, thank you. We have some great questions, and then we're going to wrap up with our panelists with some last thoughts. So, some amazing questions. I'm sorry we can't answer them all, but Maria Wardlow asks, I have a resident who asks, why do I need telehealth? I just call my doctor. How do I respond? And Amy, I'm looking at you to start us off on that one.
Sure. So that is a super important question. And unfortunately, there isn't one pat answer that's going to fit every situation. I think that, you know, a lot of patients need reassurance that the quality of the exam will be just as good as it is in person. So you have to be prepared with, you know, what the arguments are. But it also has to be specific to your health system and to the type of conditions that you're addressing. So you have to be prepared to explain to people what is and what isn't appropriate for healthcare, for telehealth. But you know, a survey that I did that's referenced in the report that you're going to get, it documented what people's specific concerns were with telehealth, and I think that could be a good starting point in putting together the rationale for it and the ways of overcoming common barriers.
Would anyone else like to weigh in on this, or we can?
I would just
I
add
think
one.
too. Go ahead.
I was just going to add one brief comment, which is there are certain things that you do when you are doing, I mean, telephone is actually telehealth, it's audio telehealth. But in terms of video telehealth, right, face-to-face, there are certain things like we can assess how people look in pain or not in pain. We can look at skin condition, right? We can see the physical environment if we're concerned about tripping hazards and things like that. So there are some things that would be benefited by being able to do video telehealth that you can't just do by telephone alone.
And I was going to say pretty much the same thing, but looking at it from the learner's point of view, what are their goals? So if they have a rash and their goal is to get rid of the rash, it's going to be much better over talk to the doctor over telehealth than by over the phone. You know, so kind of putting it, thinking about it from, or asking the person, you know, what are their goals in this encounter?
Thank you. I will do one more question, and this one comes in from David Rosen, who asks, what attitudes and strategies in the panelists' views does a digitally resilient patient need? And I actually would also add to that, what does a digitally resilient healthcare organization need to stick with it? So, Sion, would you want to start us off with that? Again, it's what does a digitally resilient patient and healthcare system need?
Well, I'll start with the perspective of a patient. I think confidence is really important. I think both Teresa and Dr. Kim spoke a little bit about this, empowering them, helping them feel confident in their ability to use those tools. I think is a pretty foundational component of that resiliency. For a system, I would just say, I guess I'll first say a lot of the attributes that make a good community health worker are similar attributes that make a really great digital navigator and allow people to offer really great support services. So that interest and curiosity about what their needs are and their ability to help them create goals together. And then that repeated interaction to make sure that, they feel like they've chosen the right goals and are accomplishing whatever they have set out to accomplish, with the resources that you've given them. So on one end, it's more about the capacity and those key attributes that help people connect with patients and help them feel empowered. And then, from the patient perspective, allowing them to sort of build their own goals and become more confident in their ability to use those tools.
Any other comments on that question?
I think also pointing out to people that they already do have digital skills if they, if they are doing anything digitally, and as they do them, pointing out that, hey, this video call, these are digital skills. So giving people that confirmation that they may know more than they give themselves credit for, and that might then bridge the barrier to learning new skills. And saying too, one good thing, to the last question, how do I talk to someone about the benefit of doing a telehealth, call on video? Well, it can also be skills that they may use in other arenas of their life. And that might be more powerful for them and more interesting to them. So you can say these are transferable skills.
And if I could weigh in on the resilient health system side, I would say a health system should be looking at their data and looking comparatively and use the covered population groups that are defined in the BEAD legislation or the Digital Equity Act legislation to compare what are the rates of using telehealth for different populations, different geographies. Talk to your help desk, your tech support desk, and find out what are the things that people are calling about, and make sure that they know how to address basic digital skill and connectivity barriers that may be the things that people are mostly calling in with. And have your partnerships lined up so that if you have a patient who doesn't have a device, you know who to refer them to. You're aware of what the federal benefit programs are, or maybe other benefits in your state or local community where people can get free or low-cost devices and skill training. So those are just a small handful of the kind of things that I help health systems with.
I would add one more thing. I've agreed with everything that everyone else has said, but I was reacting to the word resilient. And I think resilience you show when you are faced with a challenge or a barrier or a problem. And resiliency means you are able to command your resources and your relationships to overcome that challenge. So that to me says you have to have a trusting relationship between the individual and healthcare. Right. And so that they can work together to overcome whatever that challenge is, that you can problem solve it together, you can build the solutions together. So that really resonates with me, because so much of the work I do is about co-design between communities and healthcare systems. You build that relationship from the beginning and you build the solution from the beginning. The resiliency will come from that stronger relationship.
Beautiful. So before we hear your last comments, I just want to thank our strong panel of women panelists here, and Amy for a rich discussion and so much food for thought. We have a lot of questions, and I hope to lean on the generosity of our panelists to provide some resources as follow-up information as we'll be in contact with you. Again, you'll be receiving the recording and report in your email. And I also have to note on the term generosity, my goodness, Amy has provided honestly a PhD of links and beautiful resources in her report that you'll be able to reference. So we really appreciate that. We'll also be shortly putting an evaluation in the chat for you to complete. You can complete it. It's very brief now, or you'll also get that in your follow-up email as well. So I'm going to pass it on to our panelists and say, and again, thank them for joining us today. Just one last question with 5 minutes remaining what do you think are the opportunities to partner across digital inclusion and healthcare? And let's start off with Teresa on that.
Well, there is a question in the Q&A about adult education and healthcare. And I think that's a really great partnership, because when we were talking about what are the skills needed to work with with adults who may need digital literacy skills, adult foundational skills, adult basic education. They are doing that all the time. So they have those skills to work with those maybe a lower level people with lower level reading skills, lower level digital skills. So that's a great partnership. Libraries, someone had a question there too. Libraries are a great partnership. They can often be places where they have the internet there. They may have a private space. They could have librarians or digital health navigators at the library to help people learn the skills. And so they are a really great partnership. I think those are the two main areas that I'm going to talk about, and then pass it to my colleagues here to continue on the conversation.
Sian, do you want to take off that, build off that thread?
Sure. So yes, Teresa mentioned some really great ideas. What I'll say is it's a great time to become an NDIA affiliate. So I mentioned a lot of the convening that we do, monthly with a lot of different groups working in different capacities. So digital navigators, people working to help others find affordable broadband solutions, and then just monthly community calls where you'll get to learn about what people across the country are doing to inspire some ideas for your efforts. I want to quickly, Amy had mentioned, the Digital Equity Act right now and what covered populations are and how they're defined. Just so you know, every state in the country right now is working to complete their Digital Equity Act plan. So every state in the country, by the end of the year is going to have some plan, and next year they're going to begin the implementation process of those plans. So it's a good time to become involved in the work. They will be, we'll provide more information about this as it comes, but they'll be providing grants, and there'll also be an additional opportunity for other entities to apply directly, to the federal agency that's administering these programs for grants. We have monthly coalition meetings at NDIA. So if you are looking to join a coalition, first I'll say we have a list on our website of some place-based coalitions. If you think the idea of a coalition is cool and your community doesn't have one, we also have a resource to help people start one. So becoming an NDIA affiliate gives you access to a lot of resources and updates, and importantly, being able to connect with people across the country that are doing this work.
Thank you. I'll take it to Dr. Kim, and then Amy will close us out. Thank you.
Thank you so much. I think there's just huge opportunities for healthcare and digital inclusion organizations to partner. Health is something that is top of mind for every individual, no matter what field you work in or no matter what part of the country you live in. We all want to be healthy and we all want access to healthcare when we need it. So, and that is increasingly digital tools, right, to access those services. So I'll give you an example. I think digital navigation is just a tremendous need. Every hospital system is looking for digital navigators. Every community health organization needs digital navigators. I would love to see partnerships between the healthcare organizations and the local community-based organizations, the libraries, the digital inclusion advocacy groups, the training programs, to customize the curricula and the ways that people engage with the technology so they can use it specifically for health. But if they could come together and actually design the programs so that it's relevant to the local individuals and the local services, I think that would be just a bonus for everybody. So that's one thing that I would really love to see happen. The second opportunity to partner is, I think we're all just getting into the Digital Equity Act funds are tremendous, but we have to actually now design these programs. And I would really advocate for co-designing across the stakeholder groups, across industries, and with the individuals. So if we could start to do that now as we develop programs that will then roll out in the next year and into the next 5 years, I think we would really benefit everybody's mission and the outcomes that we're all trying to achieve. So those are the two things I think are great opportunities to partner.
And I know we're over time. I'll just say, when you get the report, look in there for the discussion about community health workers in Arizona, because Medicaid will reimburse health systems for the time of a community health worker to do digital navigation work. And starting in 2024, those CHWs can be working at community organizations. They don't have to be affiliated with a healthcare agency. The CHW has to be certified by the state, but it's doesn't seem like that difficult of a process. So it's a terrific model. And I'm so happy I've had the opportunity to work with Arizona and learn about that. So my thanks to Digitunity and the panelists and the attendees for a great session.
Thanks all.